Okay, I think we should start. I think we've got a good corner of people. We've got the full panel here with us, and we've got a lot of people still joining, but we're going to start the session. Welcome everybody from around the world on to this seminar. It's great to have you all here and great to have such a high interest in the session. We have a great panel and a really interesting hour-and-a-half session for you all. So really looking forward to getting into the discussion and talking through this critical issue. You can see the screen in front of you, hopefully, and the comments bar is also open for chat. So please do use that. The agenda for today is as in front of the screen. Essentially, I'm going to provide a quick welcome and introduction, and then my colleague Natasha is going to present some of the key messages from the Health Systems Strengthening Evaluation Collective to tee up what we think will be a great panel conversation for the main bulk of the session. The panelists, I'm not going to name all the panelists there, but you can see we've got some big names here. We've got some of the key policymakers and evaluators from the global health institutions that have been involved in this initiative. And so we are going to give them an opportunity to feedback their findings and their input on the topic, and then open a conversation amongst the panelists that will be chaired by my colleague Bola, who will present the discussion and follow-up questions. And then we will end with a call to arms or a request from the panelists to talk through the next steps amongst this agenda. So an hour and a half, and we will hopefully make sure you spend most of the time having a conversation, a discussion amongst the panelists around this issue. Okay, so but you know, we are very pleased to have such a high interest in the conversation, and we can see over 100 people already on the call. And we, as I said, it'd be great to make sure you use the chat function. Please do feed into that any comments and feedback, and the team here will try and pick that up and feed that back to the panelists. Great. Okay. So my name's Sam McPherson. I'm a partner here at ITAD. ITAD's a consultancy company based in the UK. And we were commissioned by the Gates Foundation to provide a backbone support to what has been called the Health Systems Strengthening Evaluation Collaborative. This collaborative was set up a couple of years ago and was funded by the Gates Foundation against the terms of reference that really was articulated to try and frame an issue that was facing and still is facing many of the global health institutions that you can see on the screen now. And that issue really is around how can we better evaluate health system strengthening investments. The organisations you can see on the screen are, of course, some of the key players in funding and supporting health system strengthening, and ultimately in evaluating those interventions. And collectively, as identified by them and by the Gates Foundation, there are a number of issues around how evaluation has failed to provide the information required to help policymakers define next steps in health system strengthening. So that's the collaborative. I wanted to flag before I hand over to Natasha that the collaborative really was a collaborative. It was a collaborative of over 42 active members that came from both the organisations that we've just flagged in the previous slide, but also from academics and other organisations across the world. And those members I can't name. I'm not going to list all the 42, but they're well acknowledged, and I really would want to flag how thankful we are for the inputs that those people have provided to this programme. They also represent a number of organisations and across a number of countries. And I suppose the reason I wanted to flag that at this stage is that we feel that the findings and recommendations that came from this work do add weight to what we've articulated. It's not just a few people, it's a collaborative exercise, and we feel that hopefully the agenda that we've helping to frame is seen as important to help move this overall discussion forward. Okay, I'm going to hand over now to the technical director of the Health Systems Evaluation Collective, Natasha, who's going to provide a foundation for the conversation that's coming up and talk through some of the key messages that came out of the Evaluation Collective. It's important to flag that those messages, of course, are the high-level messages, and there's a substantive body of work that we produced, which is going to be is available already on the website, the ITAD website that has holds all this information, which includes both a summary video, which has been well circulated of the work, and also a whole set of products and detailed publications that we produced. So Natasha, over to you.
Great, thanks, Sam, and hi, everyone. I'm just going to spend a few minutes doing a bit of a warm-up for the discussion by giving you a taste of the nature of the collaborative and the type of evaluation challenges that we tried to address and some of the recommendations coming out. So first, just a bit more background building on what Sam has said. I mean, I think that health systems now have recognition, and the importance of strong health systems is widely accepted. But how different organisations with different agendas can invest to make health systems stronger is still less clear. And the evaluation of this is still an emerging field. There's some good work that's been done, but when you put it all together, it's still quite patchy and leaves a lot of questions unanswered. So I think the hope was that better evaluation would be the key to unlocking this imbalance and help stakeholders make better investments moving forward. I think that Sam has already said quite a bit about how the collaborative was set up. Just to give you a bit more flavour of what we did, I think the first group of stakeholders were drawn together to agree this common set of priorities they wanted to work on in this endeavour. And we then established 2 working groups, as well as commissioning specific working papers between December 2020 and March 2022. And ITAD acted as the backbone, but a lot of the technical content came from a wide range of members of the collaborative. So next slide, please. So I think the idea behind the collaborative was based on collective impact and bringing different stakeholders to the table to jointly work together to try to strengthen this field. And we suggested from the outset that there were 3 key stakeholder groups that needed to be at this table. Firstly, country-level stakeholders such as governments and practitioners, and second, donors who fund a proportion of HSS investments and evaluations, and finally, the evaluators and academics who are grappling with how to do better HSS evaluations. I think from the outset, the collaborative has stressed that health systems are owned by the countries and populations that they serve, and that the perspective and interest of the country had to be key to both successful health system strengthening and doing successful evaluations. So with that in mind, the idea was to bring all these stakeholders together around this common agenda of problems and discuss how to improve the way that they can address them together. So our common agenda of work, which was agreed, included things like trying to come up with better definitions around health system strengthening, better evaluation frameworks to understand how to frame the evaluations better, looking at evaluation from a country level perspective, understanding the evidence needs of stakeholders better in order to know better how to commission evaluations to generate that evidence. And finally, digging deeper into methods that have potential to better support evaluation. And as has already been said, all the products are on a website, which I think will be shared in the chat at the end of this seminar. So I just thought we'll go through 3 or 4 key messages that came out of this work, and I've arranged them here along a kind of rough theory of change for how a health system strengthening investment might actually lead to firstly a better health system, a stronger health system, and then hopefully to better coverage of health interventions and better health outcomes. So we're going to talk a little bit about some work we did around definitions. Then I'm going to talk about the focus on health systems and how we can think about that more clearly. And then finally, some methods for measuring coverage and outcomes. And I think at the bottom here, I've flagged 2 areas which we're calling political economy issues, because these aren't so much technical as sort of political in their nature, but the question of how to align the activities of different investors and evaluators with country priorities in terms of the work that gets done, and also how to commission work more systematically and methodically between all the different investors so that we are able to build up a more cohesive and sort of synthesized evidence base on this topic. So the first area is that around kind of what we're calling better definitions, because I think in the work that we did, it became clear that the field can't really successfully deliver on the challenge of doing better evaluations without starting to align better around some of the language which is used. In our work, it became clear quite quickly that agencies, between agencies and even sometimes within agencies, different language is being used to map and categorize and describe the investments or the inputs to health systems, and that this doesn't align very well at all with the language that's being used at country level or the way that countries might be recording and classifying these investments. And I think all this adds up to a degree of confusion over how to quantify the individual investments and the investments at either country or organizational level. And that the nature of what's being done is not well defined enough to allow for clear theories of change to be developed. And those two things really mean that designing effective evaluations at the moment is quite problematic. So the work that we did here, and which you can look at on the website, is that the collaborative, and in particular one of the working groups, over quite a long series of discussions, debated and agreed definitions along the kind of health system strengthening to health system support spectrum. And I think the reason that this is important is that until it's clear what type of investment you're making and what type of effect you're hoping to have, it's very, very difficult to know what type of evaluation to do. So that's the first area to flag. I think the second one is the one that was in the middle on that first theory of change, which is that we felt that there was not as much focus or clarity on the health system in a lot of health system strengthening evaluations as could be desired. And I think some of this is because health system strengthening is often described as, there are these long causal chains between the inputs that are being made and the kind of outcomes that you might be interested in. And it's very, very hard to untangle that and to have any understanding of cause and effect. And I think what the collaborative wanted to do was try to develop some intermediate indicators that can be used relatively quickly, which fits well within the time frame in which many evaluations need to be done. So you might be looking at a sort of 3 to 5 year time horizon. And so you need to be able to look at something which is an intermediate indicator for the health system getting stronger, rather than trying to look at very long-term impact indicators. So we think you can do it earlier, and you can also, these indicators also allow a better focus on a wide range of system elements. And that this allows us to think more about the system as an end in itself, which is a good thing. So we developed process goals which cover 4 domains, and this has been written in a journal article which is shown at the bottom of the slide. And if we go to the next slide, just gives you a quick focus on the type of indicators which we developed. They fall into these 4 domains, and the idea is that you could use them both in designing the intervention and also in evaluating the intervention. And we're not expecting that any investment would manage to have an impact on all of these indicators, but I think the suggestion is these are good things to hold in the back of one's mind when thinking about health system strengthening, just to make sure that you're moving in the right direction and not potentially doing harm to the system. So that's the health systems areas which we worked on. The third thing I want to highlight is around methods. We talked a lot about what kind of methods had the potential to make a greater contribution to this field. I think the sense was that most methods to address the kind of questions that are being asked already exist, but perhaps could be thought about and applied more systematically. But just to highlight in particular some areas that came up, firstly, the value of repeated measurement using routine health information data or embedded approaches was stressed, and also the fact that the quality of routine health information is really improving. And so it would be timely to start trying to think about how to embed some of these evaluation questions into more sort of sustainable and routine systems. The second thing which was quite an important area in our discussion was around how to isolate the effect of some investments on particular health outcomes. So some of the agencies represented here are particularly interested in certain health outcomes or certain service delivery. And we have a working paper which describes how you could set up a modelling approach to do that. I think important to flag here that this was a broad collaboration, and so we had to reflect a lot of different interests. And I think what we've done is offer some ideas for different approaches that people might take, but the next step would be for specific evaluation needs by agencies to draw upon these recommendations. Final slide. And this is returning to what I referred to as the political economy at the beginning. I think two things came out from country case studies that were done and also interviews with people who commission evaluations. There's clearly a need to reduce fragmentation in this field in order to get to a point where the different evaluations being done add up to a meaningful body of work. And we thought that there was a lot of scope to do this between organisations, which I'm sure has been said many times before, but also to try and align better with priorities at country level. And in the long run, whether support to country-owned framework of HSS measurement could solve the problem for many different stakeholders. I think the final thing to say is that we also talked to people about the type of evidence they wanted to see. And their evidence needs were very, very broad and ranged from kind of implementation research approaches around to questions of cost effectiveness. And I think that this speaks to what a big field this is and how it needs to be approached with a very systematic approach. And therefore, I think organisations might want to inject a bit more stability and planning in the way they plan the evaluations over a multi-year framework, which would also allow for things like greater baseline measurement and drawing on knowledge coming in from outside of the field, such as from existing systematic reviews. So I will stop here, pass back to Sam, and allow the panel to inject a sort of dose of reality into discussions. Thank you.
Thanks, Natasha. Great job trying to summarise 2 years' work. And as I said, we have a wealth of data and reports that are on the website, and we'll feed you that contact at the end of the session. OK, so my job is to get the panel talking, and I'm going to do it in order. So I'll present, introduce the person. They'll introduce themselves, and you've got 5 minutes each. So I'm going to try and keep you tight on that 5 minutes. So forgive me if I come in at any point to suggest you speed up, but that's the idea. We want to get to the conversation. So we're going to start with Kieran, and over to you.
Thanks, Sam. Thanks, colleagues. So there's obviously lots to say on this issue. So Sam, you're going to hold me to account on the timing, but maybe just to start to thank everyone who's worked on this. To try and address this perennial challenge of measuring and evaluating health system strengthening. We're particularly grateful for the thought partnership across the different stakeholders, not just the global funding partners, but the country level implementers. And a special thanks to ITAD and Sam, Natasha Bowler for leading the working groups, and a number of my colleagues who are on, especially Katie Daly, who's been involved in this, acknowledge that. I think if you think about the challenges, they're very similar that we see that others are seeing. So I won't go too much into the detail, but I think we come away from these recommendations with a much more nuanced articulation of the challenges of good health systems evaluation and a better understanding of how to address those issues. But I think everyone would agree that we want to see any given evaluation or measurement effort to be useful to countries, but also global funding mechanisms, our own leadership and programmatic implementation partners. But the reality is we often confound these different audiences and the type of evaluation effort needed for any given purpose. For example, health system strengthening evidence that's used to show impact on a health outcome that drives a policymaker in a donor country to fund something is somewhat different and quite different from the evidence and learning required at the ground level. It's health system strengthening and decision making on what and how to invest at the national and district level. And we all would probably say the ideal state of evaluation, as we've heard, is country-owned, led, and utilized measurement frameworks. But a big emphasis on needing to be clear about the audience of those evaluations. Secondly, as a board member of many of the global funds, we're looking to see how these findings can shift us away from the dichotomous positions of looking at measuring health impact versus health system strengthening. A health minister or even a donor politician needs to know that their investments are saving lives, but done in a way and measured over time that actually does strengthen the system. But we need to be needing to measure also in real time, as we've heard, to provide that actionable feedback for program implementation while also measuring the health outcomes. How the foundation is looking at these challenges, to be honest, there's a lot that we're doing and thinking about. I mainly want to emphasize a couple of things. One is, as an investor in the various global funds and institutions, we want to support our partners to do better health system strengthening evaluation, and that collaboration that we've heard from the recommendations are already said, and we are funding and making some investments in individual institutions, but across. We also are taking the recommendations to heart ourselves and having that internal conversation about how we could be more precise about the purpose of measurement efforts for health system strengthening. And we're particularly focused around, what country health managers need, what policymakers need, and what global funders and TA providers need, which are often quite different, as we've heard. But how do we utilize the right kind of evaluations for those different purposes? And lastly, I'd really just focus on, thinking about how we take these recommendations forward. Again, I've already noted we could talk about very specific pieces, but we find a lot of value in just the shared platform that this collaborative has put together, and a sharper focus on evaluation and alignment across what we're measuring, including country and technical partners. And again, call out to ITAD to bringing in that country level experience that I think we all know needs to happen more. We're also encouraged to see the action from some of the global mechanisms and funding mechanisms, and we'll hear from them, I'm sure, a bit later. Rather than touching on the specifics, we'll let them do that. But I'll end on, in particular, we're excited to explore some of the more novel methods and approaches. There's a lot more work to be done to bring some of these findings to fruition. We're particularly excited about opportunities of modeling health system strengthening impact and exploring that with some of the partners here already. And we're interested in testing coordination evaluation approaches at the country level, and to better incorporate country experiences and collectively measure both for the country and the global the contributions that they are having in health system strengthening. So the main emphasis we wanted to say was that both the collaborative effort is important, but also making sure that we're thinking about the audience and a primacy around use at the country level, and the ideal state of being clear about what countries need in order to make the right decisions about investing in health system strengthening. I'll end there. Thank you.
Thanks, Kieran. Great timing, and thanks for the very useful framing. Okay, without further ado, Alex from Gavi.
Thank you, Sam. And just to echo up front, firstly, Kieran's thanks to everyone that's worked on this. I think I know many people and many brains have gone into it, which is great, because this is a shared and big challenge, and I think one that everyone struggles with. And I do think it's a valuable step forward, but both in terms of the thinking that's coming out of it, but also in terms of the platform that's been created and the collaboration across many agencies, but beyond the agencies, for collaboration beyond many different stakeholders, at country level, at global level. And so thank you for helping to get us this far, and I'm looking forward to seeing where we go from here. I particularly wanted to sort of appreciate three findings in the work that resonated particularly, I think, for me and for us at Gavi. One was that what should be a very basic starting point in some ways, but which is the definitional. It should be basic, but the reality is we do think about these things differently, and it is critical that we actually have a common. We use the same terms to mean the same things. It's critical for us as agencies, but it's particularly critical, I think, for countries. We're all supporting the same countries. They need to know that we are speaking the same language as them. And so I think it's also important to ensure we have nuance in how we think about these topics, how we think about system strengthening, how we align around our approaches. And so I like the real focus on definition, and I think it helps take us beyond some what I would consider to be quite outdated debates and perhaps false dichotomies, such as, for example, between the horizontal and vertical approach. I think, the reality is every agency has a mission. And every agency's investments are going to be designed to achieve certain specific outcomes, but that doesn't take away from all of us the obligation to think about how do we do what we do in a way that strengthens health systems over time and increases sustainable impact over time. So for Gavi, for example, as we think about the zero dose agenda, which is our highest priority in this strategic period, the question is, how do we think about zero dose in a way where we use that as a tracer for communities who are being missed systematically by primary healthcare services? And how do we then work with countries and with other partners to ensure that as we're programming Gavi funding to reach those communities, we're doing it in a joined up and integrated way to extend the reach of health systems to those communities with an integrated package of services? And so I think that's an example of how, I think for too long in this world, in this space, we've debated, is it one thing, is it the other? We need to find ways to get to both, but we need to be talking the same language to do it. I think there's the debate on strengthening versus support is another one. I think that the report sort of landed in a good place, which is, health system strengthening and health system support are both good things in and of themselves, but they are different, and we need to agree on how they are different and agree on where one is more appropriate than another and how we make choices around that. The second thing I want to appreciate was the kind of range of measurement approaches and the recognition that there are many different types of measurement approaches. I think for one things that I struggle with is, when we say evaluation, we often mean a very large, expensive set piece post facto evaluation, and those have their place and they can be hugely valuable, but they're also very expensive. They take time, and they often only happen. We talked about the long chain. Natasha talked about the long chain of health systems work from initial program design and investment through to outcomes. And of course, evaluations then tend to happen after that even, and after measurement has happened. And by the time you get the findings, it tends to be a long time since the action has actually happened. And so, certainly at Gavi, we're looking increasingly at a range of different approaches to measure progress on HSS, looking much more at a sort of standardized set of intermediate outcomes that we want to measure. And so it was very helpful to see how the group thought about that, looking at how we work with countries to be more deliberate in having specific monitoring and learning plans for their specific context, and then also having sort of ongoing learning in sort of deep, and what we're calling learning hubs that can go deep in certain areas. So I think that recognition that evaluation, it does not mean one thing, and we need to think about the right tool for the right purpose is really important. And then I think the last thing I would say is, the framework of process goals was really helpful. I think they really complement sort of some of the ways that we think about how to measure health systems and to kind of move us beyond the building blocks and think about sort of those cross-cutting systemic outcomes that we want, and those will be valuable. I think something we will take to heart and reflect on from our side. Maybe the last point I'll make, and then I'm going to throw a couple of questions back at you, is just to say, the point about learning and evaluation and really being fundamentally and primarily for countries, I think is critical. And I actually believe, back to this point on a range of measurement approaches, the more we can move towards ongoing measurement, ongoing learning as our primary way of measuring what we do, the easier it will be to do that. My experience with evaluations, the big set piece ones become very political, and everyone wants an answer to every question, and they become huge and unwieldy. And so the question is, how do we move more and more, I think, towards ongoing learning and measurement, and have true evaluations in the traditional sense be a complement, but not our primary way of learning about our health systems work. So maybe to throw a few questions back, I think firstly around definition, one of the things I'd love to hear from those who've been involved is what is the level of the divergence today in terms of definition, and what would it take for us to define? Are we miles apart, or is this actually something we could do relatively easily? And when we think about definitions, you know, there's a definition of systems of health systems and health system strengthening and support, but there's also definitions of, you know, the key indicators we then use to measure them, and maybe even some of the standard analyses that we look at to understand how things are performing. And, you know, is that an area that was looked at as part of this effort? And how much divergence is there as well? Because the more we could align around indicators and the more we could align around those kind of analyses, the better we're going to be able to join up our support also to support countries with strengthening their routine data systems to actually generate those common indicators and not have to be measuring similar but different indicators for every agency they're working with. The second question I had around measurement was actually on the focus I think has been on the country level. How do we better measure what's happening at country level and the extent to which systems are being strengthened? Certainly for me, but I imagine for others on the panel, that's a really critical question. And an equally critical question is how we measure what's happening across the portfolio, and are we how do we actually understand across our entire portfolio of health systems investments how we're performing, how we compare results and performance across countries, etc. It's hard if we want to tailor the measurement to individual country context, but I'd love to hear if there was any thinking on how do we get better at measuring at portfolio level and not just to country level. And the last question, because I see Sam, you've appeared on the screen, would be into question around how do we take forward this collaboration. And so, you know, some of the questions I've already asked, I think, apply to that. But I guess one particular question I'd love to hear more on is, are there some things, some best practices already that you saw through this work, which the rest of us could learn from? So one agency that's doing something that's really stands out, where you think, actually, this is something that should be replicated and scaled up. And if so, I'd love to hear more about that, because I think this is an opportunity for us also to learn from each other. Thank you.
Thanks, Alex. Great stuff, and thanks for putting the questions. And I'm not sure we're going to try and answer them directly in this conversation, but it'd be great for the panel to think about this, and also an opportunity to flag, as I said at the beginning, with the chat function on Teams is really good. Please do put your questions in. All the participants here and engage in the conversation offline as well. We'll try and bring that back to the panel as well. So good. Next presenter, Mai.
Yes, sorry, is my video working? Okay. All right, just want to say hello to everyone. And it's really, I'm Mai Hijazi, Director of the Office of Health Systems at USAID. I just want to say a big thank you for the opportunity to participate today in this really important, this really critical discussion, and to speak about USAID's role in this broader context. So USAID supports integrated approaches to strengthen health systems so that system issues and health needs are addressed simultaneously to achieve equity, quality, and resource optimization, and also really improve all health outcomes. This includes a focus on strengthening integrated primary care as the foundation of the health system and investing in pandemic preparedness and global health security. Our HSS efforts require sound methods for evaluating our HSS investments, both to improve our real-time adaptive management and to understand the long-term impacts of our HSS activities. Our HSS work aims to support sustainable improvements at the system level, and this requires generating context-specific useful evidence. We're really emphasizing evaluation and monitoring of system-level outcomes, along with improvements in specific building blocks, as documented in our Vision for Health System Strengthening 2030, which promotes systems thinking. As the collaborative's work has recognized, we need methods that can really help illuminate and assess how system dynamics and system components both interact to contribute to system change. We're working in many different ways to address some of the challenges that have been, I think, raised already by the panelists that we face in HSS evaluation. On a practical level, USAID is highly decentralized. We're a large agency with much of our program design and management led by our missions. So we're working to improve our HSS knowledge management overall, which will enable us to better understand our HSS investments and provide more support to HSS monitoring and evaluation activities in the field. And we work with quite a few countries, so this ends up being quite a complex and intensive process. I think another important challenge to talk about is that we all across the global HSS community know that many of our health investments are often very siloed. And I think this is also true in the USAID context, and it can be a challenge to evaluate the collective impact of discrete health investments on stronger health systems when they're not necessarily designed this way to begin with. So shifting our work to include a balance of both vertical and integrated investments is an ongoing process, but one that the agency is prioritizing. And I maybe just want to highlight a couple of examples. So Congress recently directed USAID operating units with 2 or more sources of global health programs to allocate a minimum of 10% of each health program area to cross-cutting health system strengthening. So in the past, we made many attempts to do this, but now this is at the level of a congressional directive, so a lot more effort focused in this space. It really represents a huge opportunity to further synchronize our investments across our health condition-specific programs with an integrated approach to health system strengthening and to better align with country priorities. USAID's Global Health Bureau also recently launched the Accelerating Primary Healthcare Collaborative. Some of you may be aware of this, which brings of USAID approach for primary healthcare. This initiative is designed to harness existing global health programs and better integrate health services while also strengthening countries' health systems. USAID has in addition announced the expansion of our global health security investments by doubling the number of partner countries we support in preventing, detecting, and responding to emerging infectious disease threats. Strong and reliable primary healthcare systems not only provide essential services, but are also central to effective pandemic detection and response. The COVID-19 pandemic also revealed that countries with stronger PHC and integrated preparedness and outbreak response measures in their health systems are more resilient and better able to respond to emergencies. And the reason that I bring up all these examples is that it just highlights the importance of our integrated HSS programming as a key focus area as we move forward with our priorities at USAID. We're very much working on strengthening our staff capacity in health systems evaluation, and more broadly in all aspects of HSS monitoring, evaluation, research, and learning through increased training and capacity building and opportunities for our field staff. In general, USAID supports a context-specific approach to HSS evaluation, where the evaluation methodology is geared towards understanding the investment's theory of change, building evaluation questions around it, and selecting the appropriate methodology that could answer the evaluation questions. And then maybe another important point to raise here is that USAID is focused on localization as a policy priority, recognizing that resilient and prepared health systems require the participation of a wide swath of stakeholders, from government, civil society organizations to private institutions. We continue to focus our programs on strengthening local capacity, and we see these efforts as core to strengthening health systems. So this really aligns well with the collaborative findings that funders of HSS evaluations should design our work to involve participatory, inclusive consultation with country stakeholders. And I think the collaborative country case studies will be very, very helpful in this regard. So going forward, we look forward to carrying out more aligned and country-centered evaluation efforts in partnership with all of you. I just want to say thank you, and I certainly look forward to the discussion and hearing from others. Thank you.
Thank you, Mai. Very useful. Thank you. Okay, let's keep on the moving. We've got 2 more speakers in the panel to present. Shun.
Thank you. Shun Mabuchi, Head of Resilient and Sustainable Systems for Health. And as everybody, I'd like to really congratulate and thank particularly the ITAT team and the Gates Foundation team. So I've seen the former the struggle of this very complicated and challenging work through the former capacity at the Gates Foundation too. So really congratulate on landing on the robust conclusions. I will talk about the challenge we face and how we are aiming to address them, building on the findings of this collaborative. So first challenge, as you know, our mission as a global fund is end the epidemics of HIV, TB, and malaria, and reduce health inequities. So our main question we need to ask ourselves about health systems investment is how they improve the systems for health and contribute to the HIV, TB, and malaria outcomes. And as we expanded our mandate and work seriously on pandemic preparedness, how does health systems investment contribute to pandemic preparedness of countries is additional question to answer. And as we set integrated people-centered quality services as a main pathway for health systems investment to improve HIV, TB, and malaria outcomes, we also need to know if our health systems investment really improves integration, people-centeredness, and quality of care. And we need to build robust evidence in the next 3 years or so on this. So it's a big, big challenge. How are we approaching to it? And our approach to health systems is that instead of trying to improve health systems as a whole, which is really, really complex, we focus on subsystems that we have some strengths and that can contribute significantly to HIV, malaria, and TB control, such as community health workers and community-based and community-led organization systems, human resources for health, laboratory systems, supply chain, and M&D systems. So what we are aiming to do with a great help from the Gates Foundation are 3 things. 1, clearly define the maturity model of these subsystems and build approaches to measure the improvement of their maturity through our investments. For example, we developed Community Health Worker Systems Index that measures the maturity of the systems to support community health workers to work effectively based on the WHO guidance, and made it as our key performance indicators at the corporate level. We are aiming to build similar approach to other subsystems. Second, we measure the improvement in integration, people-centeredness, and quality of care. We co-developed the key performance indicators around these together with the primary healthcare team, measurement team of WHO, and in consultation with many joining here at the panel. And then third, we used this data to model and estimate the improvement of the system's maturity and integrated people-centered quality services to HIV and TB and malaria outcomes. So in the collaborative question or framework, we are aiming to target understanding the health systems investments impact on intermediate level outcomes of systems maturity and integrate people-centered services and link it to the disease outcomes. And obviously the big challenge is operationalizing this in countries. And as many of these data are not available through the routine data systems, we are aiming to support countries to carry out light and very targeted health facility data collection. And we are aiming to do this in a way this collaborative work concluded. So with inclusive consultation with country stakeholders, build country capacity for health systems evaluation and data collection, analysis, and data use, and really help countries to use the data to improve their investment. So we are aiming to use the country grant we have with the country for the country to actually do it under the country ownership model. And this is a hugely challenging job, particularly given our short grant cycle, 3-year grant cycles. However, we hope to do it in consultation and collaboration with others here in the panel and really advance the field collectively. So I'll stop here. Thank you.
Thank you, Shun, and thank you to all the presenters so far for being so tight on the time of the 5 minutes. So last speaker, but not least, Peter, see if you can sit at 5 minutes, and then we can open the conversation.
Thank you very much, Sam, and Happy New Year, everyone. I'd like to speak to three big challenges for our organization, the GFF, in assessing the effectiveness of health system strengthening interventions. The three big challenges are heterogeneity, complexity, and context. I think starting with heterogeneity, the different system strengthening investments that are often fit under the very broad label of health system strengthening are highly variable and wide-ranging. I think often to the point where the differences between them are often greater than the similarities. For example, differences between investments to strengthen service delivery relative to those that aim to strengthen national financing systems or governance. And I think this is not an academic question, but something with very practical implications that's part of what we need to grapple with as we all aim to become more competent and effective as investors, practitioners, and evaluators in this space. Second big challenge is complexity. And I think this is already well captured in Natasha's presentation and the comments of others. Clearly, this is not a situation where you pull lever X and you get simple result Y on the other side. We're talking about multiple factors coming together to influence a result through a causal pathway that is usually quite long and complex. And as I think noted by Natasha, often the very critical question is, how is the relationship between different factors in that causal pathway changing in some kind of ongoing or sustainable manner? The third challenge is context. I think it's very difficult to isolate system strengthening investments from the context in which they are designed and implemented. What works in one context may simply not work in another context. So, for example, one can have a very high quality evaluation of an investment to strengthen the role of a community health worker cadre in one environment. One, I think, could learn a lot from such an evaluation. At the same time, if one tries to disconnect the findings of that evaluation from these specific contexts, for example, excuse me, the enabling environment, the different ways that CHWs are being supported, how they are linked to other levels of the health system, what is happening in terms of community engagement, trust, and demand. If we try to disconnect or isolate the effect of the health system strengthening investment from that context, then I think it's simply unlikely to work the same way in another context. So I think that's very clearly something that we also need to grapple with. Excuse me, how is the GFF addressing these challenges? In the past year, we developed an implementation research and evaluation strategy. This was approved by our governance bodies around the middle of last year, and we really benefited by being part of this collaborative. I think what we learned from the exchanges and interactions, the learning generated, the definitions, the approaches, the frameworks, the tools, and the resources really helped shape to a significant degree the content and approach of that strategy. And I think it's worth noting that the GFF implementation research and evaluation strategy isn't only about systems strengthening, but at the same time, the GFF only works through a systems approach. We do not operate through any vertical support modalities. So in that sense, the work of the HSSEC applies more broadly to the GFF rather than just to a subset of investments. So really, I think this is less about how we do HSS evaluations and more about how we do evaluations writ large. Another key way that we're addressing the challenges is by operationalizing the strategy in a way where we build implementation research and evaluation into our core engagement model, starting from the investment case process, including how we embed implementation research to better understand implementation factors during implementation and inform adjustments. And in doing so, we are combining an interest in long-term outcomes, recognizing, as Natasha noted, that one needs to bear in mind a longer-term perspective around the accrual of benefits of a system strengthening intervention, often 10 years or longer, we aim to combine that long-term perspective with more rapid cycle approaches that provide very timely feedback that can be used to inform adaptations and course corrections. I think, for example, as Alex noted earlier in his comments, if we're only operating on that long-term time horizon and not considering real-world information needs that managers, policymakers have along the way, then I think we are likely to fail in our system strengthening efforts. Now, in relation to how the findings of the HSSEC can further help the GFF move forward in these areas, as I noted already, it's been very useful to have these common definitions and understandings to work from. I also think the concrete steps that are agreed as part of this process are very useful, starting with mapping investments more clearly. We have been doing a lot of work to strengthen work together with other partners on resource mapping, expenditure tracking. So, for example, to better understand in how resources are being allocated to different levels of the system, how much, for example, is being allocated and spent at the frontline level. I think another agreed step, which is very useful, is improving the theories of change behind system strengthening investments. And in my mind, this is like good hygiene. If we are not clear and transparent and explicit about the theories of change underpinning system strengthening investments, I think it's very unlikely. There's very little basis for evaluation, and I think it's also very unlikely that those investments are likely to be successful in delivering on the intended results. We have a new resource called the GFF Data Portal, and we are trying to advance an approach. I would not call it radical transparency. I think it's more like common sense transparency. We are bringing more data and information about our investments and engagements into the public domain for anyone to explore and use. And within that, we are experimenting with how we can be more effective and clear in bringing the theories of change around systems reforms that we are supporting. On what basis are various reforms prioritized? What are the assumptions about them? How do they relate to changes that can be observed across different levels of the causal pathway? So in developing a type of health systems reform tracker on the portal, we do aim to be clear on those theories of change. The next action, which I think is really critically important, is strengthening country leadership of the implementation research and evaluation agenda. Within the strategy that we developed, this is the first objective we've put forward, with identification of a range of actions to advance this, including working with national entities within ministries of health or elsewhere that are responsible for coordinating research and evaluation work within the sector, and anchoring our own support and investments to that function. And of course, also, as noted by others, strengthening the leadership of local universities and other in-country technical institutions who should be leading the work technically and the follow-through over time. Last but not least, this has been a collaborative process, and we very much look forward to the follow-on from this activity and advancing our work together with other partners to support country-led efforts to strengthen health systems. Thank you.
Thank you very much, Peter. My name is Bolo Yiledu, and I head the Center for Integrated Health Programs in Nigeria, and I've been part of this collaborative. So I want to thank you all, the panelists, for your deep insights and questions shared today. I also commend your agencies who are also co-collaborators in this key engaging process of finding answers for better definitions, measurements, and processes. As you have all highlighted, country engagement and ownership is critical, but we know that this is often fraught with myriad challenges. It is often not very well coordinated, most times not very collaborative, plus the tension that happens between what the investors want and what the policymakers and what is really practical at the country level, as some of you have already highlighted. So my question to you this afternoon, this morning, is moving forward, how can we do better at alignment? And some of these areas have been flagged in the chart, so I'm bringing up here. For instance, the indicators, And how do we make sure that we are commissioning evaluations, HSS evaluations from the country lens? And we need to know that we know that one size would not fit all. And how do we make sure the tension between maintaining your strategic framework versus letting everyone do something different? So I'm going to ask you, how are we going to take this forward, especially from the outcomes of this work and your valuable contributions to the discussion? So, Alex, I see you. Do you want to go first?
I'm happy to. I was responding to Sam's instruction to put our camera on, but I'm happy to go first. And I think there were several questions in there, Bola. So thank you for them, and I'll try and do them justice. I mean, I think for me, on the first part of the question, how do we do better on aligning our approach? I already hinted at it a little bit in my questions, but I do think, I think we should start with the basics of, let's just align around a definition of what we mean. And let's align, and I do think we should be able to do a better job of aligning how we measure what we mean, in terms of at least what are the core indicators. I saw some reference to the idea of core and additional indicators in the chat. If we're all measuring the strength of a health workforce, we should be able to have a common way of defining that, which allows for alignment across agencies, allows countries to only measure one thing, and for us all to align our support to them in strengthening their routing data information systems to be able to measure that effectively. And so I think that is a second piece. And then the third is around the analytics that we do, and how we think about being able to compare and learn from each other. At the moment, because we assess our own investments differently, we actually struggle to even compare what we're each doing, and therefore understand where some agencies doing well and where other agencies doing better, and how can we learn from each other. And so I think there's a basic package of hygiene measures we could take that would take us quite a long way. So that's one. I think the second thing I would say is, and this probably cuts across your two questions, evaluations are expensive, they are time consuming, and they are a large lift. If we're talking about classic evaluation, it's been interesting in the Gavi experience, because we used to mandate regular evaluations of our grants, and we remove the mandate but still encourage it. But what we've seen is very few countries actually do it, and the reason is because of the primary reason, in my view, is the expense. It's just when there's a fixed amount of money available, most countries would rather invest it in actually strengthening the system in the near term, rather than conducting an evaluation, which may inform future efforts but won't have an immediate impact. And so I think we need to recognize that. And I think one of the questions for me is, could we be doing more joint evaluations? If we get to the point where we have a common definition of the system, we have a common definition of the indicators and common at least core analyses, can we go one step further and actually have pooled funding for investment as well? And then I think the third, maybe if I was to push us one step further, the third opportunity for alignment is actually around outcomes. And I think the process outcomes or process goals that were defined are good ones. But I also wonder whether there are some common outcomes that we could align around, in a more tactical way, in say the next 5 years, the next 10 years, aligned to, for example, the SDG agenda. I already mentioned zero dose, and this is to some degree self-serving as Gavi, but the reality is that most of the communities where there are large numbers of zero dose children are communities who are being missed by health systems systematically. And therefore, could we say collectively, actually it's a collective goal to reach those communities. Let's join up our efforts to do so with integrated package services, but also join up then our measurement of how well we're doing in reaching them. And so I don't think we can all have the same outcomes for everything. We do have different missions, but I think if we could at least align around some common outcomes, that would help. And then to your last question on kind of evaluations from the country lens and how do we take it more from the country lens, I would argue personally that we have to let countries make the choice. And so I do think the step towards removing it being a mandate for countries is an important one. Is evaluation helpful or not? And I think that's where the range of measures to me is important. I think what we need is a more deliberate conversation, which we're trying to move towards as we kind of roll out our new grants for our Gavi 5.0 strategy with countries to say, what is the right approach to learning and measurement in your context? And it may be an evaluation, but it may actually be just strengthening your routine HMIS to be able to measure some things. It may be that you need actually to be doing kind of ongoing mini pulse surveys or various other things that allow you to learn. But I think really we have to empower countries to make that decision and not be imposing from global level, this is the answer, because I don't think there is a one size fits all answer.
Thank you very much, Alex. So maybe I'll go to who wants to add something, but I'm interested, because you did talk about the integrated outcomes and also the fact that the USAID or the US Congress has asked that 10% be allotted to evaluations. How do we make sure that, for instance, when we're talking about the at the investor level, is this something we can actually do collectively, or are we doing, because I do know that was Gavi or the GF at one point or the other at putting something like that. And how do we then make sure we're using those resources to support like an approach that Alex just clearly described in terms of alignment, in terms of country focus?
Yeah, sure. Happy to respond to that. So this is actually the first year that this directive is in effect, and it is something that we're actively working on right now. So I think, like I said, in the past, to date, we still even have a lot of vertical HSS investments, whether it's for our HIV, TB, malaria, MCH, and family planning programs. But I think this directive is giving us a good nudge to try to look at what are some of the common health systems vulnerabilities. I think we know there are multiple, whether it's related to service quality or service coverage, whether it's related to the number and types of healthcare workers, whether it's related to supply chain stockouts. There are many areas that actually serve as common vulnerable points across each one of our programs. Our investment to date, so far, however, have been mostly vertical. So even the simple question, when you do an evaluation, there may sometimes be a tendency to do an evaluation within that vertical program versus really looking across programs. So one area that we could definitely focus on more is say, like, what are some of those common indicators or goals that we're striving for across these multiple program areas that USAID supports, and say we're going to start tracking outcomes for those. And then in the future, when we do evaluations, ensure that the evaluation is comprehensive across our programs. So this is really just the launch happening right now. I think for those of us who work in the health system space, we're really excited about it. And I'll just be honest, though, sometimes, when you have your malaria program or your HIV program or your TB program, the primary goal of that funding is to achieve results within that space. And I think at the Global Fund, you probably face similar challenges. So how do you get people who tend to work within their program area to think and commit to that bigger health system strengthening agenda? So these are areas that we're certainly discussing actively. I would say that work through this collaborative can be extremely supportive of that, whether it is agreeing on a small set, but a common set of indicators that we know should be highly relevant, whether it's 0 dose, whether it is even incorporates 95, 95, 95 from the HIV space, right? And the systems needs mortality of women of reproductive age and children under 5, or even looking at the service coverage index over time to say, are we all committed to improvements in some of these core areas? So I welcome input from others, but I would say getting organized and getting concrete. We don't need a long list, but maybe a core list of indicators that we might want to focus on. So that is a suggestion in terms of taking this forward, so that when we plan those expensive evaluations, maybe we can also have them focused to a certain extent on some of these priority areas that will really move the needle on improving life quality and survival. Thank you.
Thanks, Mai. And Shun, because Mai just asked you, and with the Global Fund, with the broad investments, developing core indicators How do you think we can move with that? Because I think it's coming across board from what we're saying and from what people are putting in the chat box.
Thank you. Yeah, so I can't agree more with Maya and also Alex in terms of country-owned approach. Maybe I'll respond in two ways. One is common indicators and goals. Great. And one potential approach, as I said, could be really defining the key areas that we really want to progress, and then think about the maturity model of it. And the community health workers program could be really a priority area for many different institutions and different countries. And then can we have the aligned maturity model measurement approach to that's agreed by country for us to use together. Those things could be helpful. And then the second, related to also Kieran's point on the dichotomy and my point on how we can have the disease communities together for the common key indicators. This is a very important area for us and for me personally too. And I've been discussing with a disease team a lot. And we have been approaching this before from health systems point of view. Like we have kind of typical health systems building blocks that we, in different forms, we tend to use. But that doesn't resonate with the disease program team because disease program has specific problem to solve, specific systems to really address to achieve the disease outcome. So what I'm trying to do now is really to flip it and then start from what is the key systems for HIV to have the better outcome and sustainable outcome, and what is the key systems need for TB and then the malaria, and then try to understand their own language, what is the systems need problem, and then lay that out and then think how we can really put those things together in a common way. For example, if I ask our head of HIV, what is the key systems need? The answer is not really health systems building block. It's how can we build a prevention system for HIV? How can we build the sexual health systems in countries that are really critical? And prevention system component is different from the health systems building blocks, but understanding those from their language and try to come back from that through the theory of change the ITAT colleagues mentioned to find a common denominator to build the system could be an interesting thing to try. So that's yeah, my response. Thank you.
Kieran, I see you nodding so vigorously. So I think you do have an insight into how we can do this. And Shun has really captured it. I wear both a disease lens and a systems lens, and I can really understand what he's talking about when he's trying to get people together. So Kieran.
Yeah, appreciate that, Bola. I maybe not to talk to that. I think others have talked about the sort of disease specific, and I really back to your first question. I think, I mean, we would all sort of agree that, you know, global solutions, top-down approaches are fundamentally not the answers. And I'll come back to that in reality. I mean, we all know that we want to see a health system national health system strengthening strategy, a health system strengthening financing plan, and then a national health system strengthening MLE system. You know, and that's the kind of ultimate goal. And part of this is a thinking about that latter part, about how that's built, rather than just the who can fund and who, you know, global needs, and I'm going to come on to it. But it's that fundamental issue at the end of the day, that a country-driven, country-led measurement and evaluation process needs to be in place. And that probably doesn't exist in that many countries at the level we probably want it to. So there is that fundamental question about that. I think there are some, given that though, you know, one of the things around the collaborative efforts that I hear colleagues talking about is how do you incentivize that to happen from an institutional perspective? There are champions here from the different institutions that are clearly committed to doing this, but I'm not sure we necessarily yet have a clarity across the institutions around how you incentivize, you make sure it happens, of many of the things that colleagues have been saying around that collaborative work. And some of that is a basic things around, yes, definitions, joint definitions, etc., but it's also around transparency of the work, transparency of the data, transparency of how and who is being funded to do this at the country level and other places. And I think there's something to that about sharing that information and maybe linked to Mai's comments around the collaborative, like the act of having a collaborative may be a useful source to that, but it then needs to be layered with kind of institutional structures and incentives that ensure that this is happening. The only last thing I would say a little bit that hasn't come out is around data quality and availability. I think sometimes when you look at the kind of health system strengthening, but also support elements, real-time data that informs systems needs, system strengthening needs and performance aren't necessarily there either. And that applies to support and that applies to disease-specific areas. But it's like, how do we as a collective sort of think about that, not just the long-term evaluative processes, but real-time data and access and transparency of that data so that all stakeholders can actually work with countries on it. And I think that's still a missing piece. Thanks.
Thank you, Kieran. And just quickly, Peter, last words from you before I hand this over back to Sam, conscious of the time. Just last words.
Thank you, Bola. I think the points raised by others are very much resonating with me. I mean, maybe just add one point very briefly, which is, following the thread that really, I think the greatest impact and positive influence can be strengthening the way that our collective efforts to strengthen the evaluation of health systems, the way that we align around that, we need to anchor that to very specific country-led efforts, clearly. I don't think that's a new point. I think that's probably been expressed by all of us in different ways, but I think breaking that down concretely points to certain entry points and practices that may be very useful in practical terms. So for example, I think all of us represented here are supporting CHW strengthening programs across West Africa and other parts of Africa and Asia and elsewhere. And I think as Kieran noted, I mean, formulating questions in terms of what are the national strategies and plans in place, not only around effective delivery of that strategy to strengthen the way that the CHW cadre is functioning within the system, but the information, learning, and accountability needs around that, right? What are the mechanisms in place to help inform the extent to which implementation is occurring as planned, the extent to which different changes at different levels of the causal pathway, from intermediate level through to longer term outcomes and impact. To what extent are the intended changes being observed? What adaptations need to be made along the way to strengthen the effectiveness of those programs? Where are deeper evaluations or explorations needed on specific aspects of that work for learning purposes or accountability purposes, or to inform course corrections as needed? I think the more we can anchor our own efforts in strengthening those country-led processes to do that, including the way that local technical institutions and relevant units within ministries of health and other parts of government who have the mandate for coordinating a research and evaluation agenda, the more we can anchor on those structures and processes, the more I think we can make progress in practical terms. Thank you.
Thank you very much, Peter. So thank you all very much for your contributions. I'll have to hand over to Sam now, but it is obvious that the conversations are just starting, and I look forward to all of you as key investors and others that are not here in really making sure that we are strengthening country-led and country-owned processes, incentivizing collaboration, and also looking at those core indicators that we can all work towards together to really define and measure what we're looking at. Thank you. Sam.
Thank you, Bolo.
Over
And
to
yes,
you.
please can the
Thank you.
panelists stay on your cameras on, including you, Bolo. So we've got 10 minutes left, and so I'm going to give a challenge to everyone on the panel to a couple of words, a minute each, on next steps, call to arms, one thing that came out of this conversation, if that's okay, and then we'll close because we need to finish by the half hour. So in no particular order, I'll on my screen I've got Alex on the top right hand side. So Alex, you first.
I think this is very unfair. I get the least time to think about answering the questions. So I'm going to cheat and say, you know, I do think there was good traction around actually moving from a common definition of HSS to a common set of indicators that we can use to at least measure the foundation. And I think, you know, it's not going to be perfect. It's not going to answer every question that we all have, but I do think that it would be, that's a conversation we should take forward out of this and see if we can create common definitions for the common indicators and common definitions for those indicators.
Thanks, Alex, and very well done going first. Peter.
I would say strengthening country-led processes that are critical for effective design and execution of an evaluation and learning agenda to inform improvements and to strengthen accountability that we all then can anchor our support on in concrete ways.
Shun.
Thanks. Building on that, we should keep our conversation really live and share the active trial of different approaches, and also wherever we have the common countries to work together, we should work together to develop the common approach. Thank you.
Thanks, Shun. Mike?
Yeah, maybe agreeing on points that have been made already. I would say ensuring that when we do evaluations, that they really are country-led. I think having a core set of indicators would really help us focus on common goal areas. And then, you know, I really like Kieran's point about real-time data. We tend to do surveys and evaluations and then have long intervals in between. And I'm personally very interested in exploring the space of real-time data and how we can strengthen that for monitoring health systems performance. So those would be my 3 points. Thank you.
And last but not least, Kieran.
Yeah, maybe I think I agree with the colleagues, and especially the last comment. So just to say 2 things, I suppose. One is, you know, testing coordinated evaluation approaches at country level seems like the thing that we need to make sure we focus on. But how we incentivize it, that's a real sustainable thing rather than a one-off, because again, I go back to this group are good people who want to do this, but we really need institutional buy-in that this is where we're leading. And the only other thing I would say that is different, because I agree with the colleagues, is we are really interested in exploring sort of novel methods and approaches, both back to the real-time data piece and ongoing, but also thinking about this question that keeps going back around, you know, this dichotomous position around support versus strengthening, vertical versus horizontal. There are means and ways in which we hopefully, either through modeling or other approaches, that we can allow for the impact evidence, both on system strengthening and on the health outcomes, to exist while still incentivizing systems investment. And I think it's that stuff that I still think we need to unpack, that we kind of lost in this conversation, that I think we want to go back to. As the Gates Foundation, we're particularly interested in some of that. I'll stop there.
Excellent, thank you, and thank you to all of you for taking part and discussion that's taken place. We are, believe it or not, ahead of schedule. I didn't think this would happen, but I don't think anyone will be disappointed by the fact that you give an extra 5 minutes to your day and wherever you are. So a couple of things. Firstly, thanks to the panelists, but also thanks to, as I said at the beginning, the many people involved in this collaborative and have been involved over the last couple of years in pushing this agenda forward. It's been a tremendously interesting piece of work to be involved in, and we hope it will continue in one form or another as we move forward. As it's clear from this conversation that all the solutions have not been found, and this knotty agenda will continue to be something that faces all of us as we move forward. So thanks to everybody, and thanks of course particularly to Gates Foundation for funding this work and for the various people that have been involved. And I do think it'd be worth mentioning Katie, who's been our project manager on this and PO overseeing this piece of work and held our feet to the fire very closely over the last couple of years. So thank you, Katie, and everyone else involved. The products that have been produced on from this piece of work are all on a website. And my colleague Rachel, who also I need to thank, has been very project managing this from our side, is going to put this has already put the links to the websites on the comments bar. And also a great chance to thank everyone for the comments actively in the discussion. We've recorded them along the way. There's been some really interesting comments and feedback, and we are going to record these as part of our overall product. As several of you asked throughout the session, we have recorded this session. This recording will be circulated to everyone involved, but also will be posted on the aforementioned website, so everyone can look at this at their leisure, and please do circulate it. And the final pitch to flag is there is a very short video, 20-minute video, which summarises some of the key findings and recommendations from this initiative, which is being posted on the website, and I think gives a very good overview of the work that's been done. So, as I said, I'm going to give you all an extra 5 minutes to your days, and it just leaves me to thank everyone involved and have a good 2023, and may the health systems get strengthened.
Thank you so much. Thank you.
Thanks so much, everyone.
Thank you all. Bye.
Thanks, everyone.
Bye-bye.
Bye.
Bye.
Thank
Thanks
you.
all.
Bye.